I introduce myself as Dr. Sushmita Bhaskar, a faculty working in the discipline of Environmental Studies in the School of Interdisciplinary and Transdisciplinary Studies, Indira Gandhi National Open University, New Delhi. Welcome to this session on the impacts of pollution on human health. This forms a part of the course MEV 005, that is the course Occupational Health and Safety. So in our daily life, we are exposed to several types of pollutants. This could be from the air, from the soil, even from the water that you drink. So all this may have different types of pollutants, and these pollutants may be like you have the heavy metals, you can have the solid waste pollution around you, then the air pollutants. This can have severe kind of the compounds which can actually give some kind of irritation to your eyes. They can cause skin and dermatitis, respiratory problems, and so on. So all this can have the impacts on the human health, and they act very slowly. In some cases they may be very immediate, and that may be chronic and acute, that you need immediate requirement of the action and treatment to be taken. But in some cases it can take a long time for this to manifest, as in the case of arsenic and arsenicosis. So people may not be even knowing that they have the disease, and after a period of time, then they realize that their skin is affected, then they have some kind of problem with the kidney, there is ailments with the kidney, and so on. So these are all due to the different types of pollutants that we are encountering in our environment. So let us now learn a little bit more in detail in this session. So our environment, we all know from our forefathers, from our ancestors, we all know that how pristine our ancient environment was once upon a time. And this is actually the natural wildlife habitat for many of the organisms, the birds, the flora, the fauna, and that is why we are more concerned about those endangered species, about protecting these species in their natural systems. And these environment, that is the environment or the planet that we are living in, that is able to even absorb the toxic gases that are coming from our own industrial activities and so on. They also regulate the Earth's climate, and they are biogeochemical cycling elements, that is the biogeochemical elements are being cycled in the proper way, and they also absorb the very toxic gases, like for example in the water bodies like the wetlands. They act as the hotspots of biodiversity and also water purifying systems. So they are natural filters or the kidneys of the landscapes. So our environment is providing so much for us. Now in this figure, if you see, it is so nice to see that warm and refreshing cup of green tea. And even this green tea, this has a lot of antioxidants, like for example the tulsi tea or that which has the chamomile. So this can actually act in the various problems relating to the insomnia, that is sleeping disorders, or even stress, anxiety, and it also elevates your mood, and the overall psychological and the social well-being of a person is also being uplifted. In the same way, this purple flower that you see in this figure, that is that of Digitalis purpurea, which it is actually lowering the blood pressure of the people. In the same way, even the sight of the birds, the sight of a kangaroo in a zoo, the sight of an ostrich, so many other things that that are so nice to the eye, and even the trees themselves. Right now in the Japanese therapy, they say that if you walk in a forest which is surrounded by the trees, and the trees themselves, they actually have a lot of the good being, and that creates a lot of good in your body and the human health. So it is a sort of a medicinal therapy which is helping people to recover from stress and so many other environmental pollution and related disorders. But what has been happening in the recent years? We are dumping our environment with a lot of the pollutants for our own selfish needs, for our own industrial requirements. So they are not following the standard procedures and the protocols, and then these wastes are actually being dumped in the environment as such. In the same way, even when we are segregating the waste at home, we have to be very careful the kind of the products that we are using at home, because materialism and consumption. So green consumerism is very important, that we know the type of food that we are consuming and the type of waste that we are generating to the environment. So all these small changes can have a big impact, and it can help reduce the impacts that we are causing to our own health and also to the environment. So human beings are in constant interaction with all the components of the environment, and that has a big bearing on the health. So we need safe, healthy and supportive environments for good health. So even a walk in the park, that is able to give so much of good health for our well-being. In the same way, when you're actually doing yoga in an open space, even in your own terrace, and if it is an independent house and there is a lot of space around, then you can see the amount of good air and the fresh oxygen that you are breathing in. But when you are living in crowded places, when you are living in unhealthy conditions, then that also has a bearing, that has an impact on the health. So that is why you need to make the healthy choices if possible. But here again, poverty and various other factors, socio-economical factors also influence the type of the living environment and the work environment that we are exposed to, and that can have impacts on our health. So the environment as a whole, in general or as a whole, if I have to say, the environment in which we live, that is a major determinant of our health and also our well-being. So we depend on the environment for the energy resources, for our natural resources, for the minerals, everything to sustain life, for food, for the safe drinking water, for nutritious food and also the safe places to live in. Many aspects of our environment, and this can be both the built and also the natural environment, this can have a big impact on the human health. So now how do we define health? Health is a very important aspect and it is very essential for life and for living. So that is why even in the corona pandemic we realized how the money is alone not important, but good health is everything if we need to survive in this world. So, and how is good health? One is, of course, your own metabolism plays a very important role. The type of food that we are eating, that plays an important role, and also the type of environment that we are living in. So all this is playing a very big role in our own development and well-being. So this refers, the health, it refers to a state of complete emotional and physical well-being, and good health is central to living a longer and more active life. So have you ever wondered why our forefathers, your own grandfathers or grandmothers, they would have lived up to the age of even 92 or even 88. So why? This brings questions into your mind. Did they live in a pristine environment, a clean and pure surrounding? Definitely that has impacted good health and their well-being. So health is directly related to the nature of the environment, weather and also to the climate. Now, the definition of health as given by the World Health Organization in July 1948, they said that this is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. To this, there has been an added clause that includes the ability to lead a socially and a productive, economically productive life. So this is a definition that is given by the WHO. So the importance of environment in health is that the environment is one of the most important components in the epidemiological triad. That is, you have the physico-chemical, you have the biological factors, and of course all this is impacting the human health. Various disease conditions, you see that they appear when there is an interaction of the agent, the host and the environment, and that includes the human activities which are affecting the environment. Now one thing you have seen, when the environment is unhygienic or the sanitation conditions are not good, you have seen that the vector-borne diseases are on the rise. So recently you have seen that in many places the dengue, the chikungunya and the mosquito-borne diseases, even the flea-borne diseases, plague and all that. Why is all this becoming dominant? So you have to relate that maybe the environment is unhealthy, the sanitation conditions are not proper. So all this can relate to the health of that place. Again, the environmental health, it is a branch of public health which is concerned with all aspects of the natural and built environment which affects the human health. So the environment health, it focuses on the natural and the built environments for the benefit of the human health. The major sub-disciplines of the environmental health, these are environmental and occupational medicine, toxicology and environmental epidemiology. The World Health Organization defined environmental health in 1989, a document that was given by them. They said that those aspects of human health and disease that are determined by factors in the environment, and it is also referred to the theory and practice of assessing and controlling the factors in the environment that can potentially affect health. The environment health, also by the WHO, it includes both the direct and the pathological effects of chemicals, radiations, biological agents and the effects on the health and well-being of the broad physical, psychological, social and cultural environment, which includes housing, urban development, land use and also transport. As of 2016, the WHO defines environmental health and it states that the environmental health addresses all the physical, chemical and biological factors that are external to a person and all the related factors that are impacting behaviors. It encompasses the assessment and control of these environmental factors that can potentially affect health, and it is targeted towards preventing disease and creating health supportive environments. They also defined environmental health services. So these are the services which implement the environmental health policies through monitoring and control activities. They promote the improvement and environmental parameters and increase the use of environmental friendly and healthy technologies and behaviors. They also have a leading role in developing and suggesting new policy areas. The 5 basic disciplines that generally contribute to the field of environmental health, they include environmental epidemiology, toxicology, exposure science, environmental engineering and environmental law. Each of these aspects or each of these disciplines, they help address the problems and solutions in environmental health. Now the information that is drawn from epidemiology, from toxicology and exposure science, all this can be combined in order to conduct a risk assessment problem, a risk assessment program for the specific chemicals, mixtures of chemicals or other risk factors in order to determine whether an exposure poses significant risk to the human health. This can in turn be used to develop and implement the environmental health policies, and that, for example, it regulates the chemical emissions or imposes standards for proper sanitation. The actions of this environmental engineering and law that we discussed before, that can be combined to provide the risk assessment in order to minimize, to monitor and otherwise manage the impact of the exposure to protect the human health and to achieve the objectives of environmental health policies. So that is how the disciplines of the environmental health are helping in addressing the problems related to impacts of the pollution on the human health. Now the environmental health also addresses all the human health related aspects of the natural and the adult, the built environment, and the environmental health concerns include air quality, biosafety, disaster preparedness and response, climate change and its effect on health, environmental racism. Now the other aspects are clear and you can understand them better, which have already been explained in the previous sessions. Now environmental racism may appear to be a new term. So this is basically wherein certain groups of people can be put at higher risk for the environmental hazards such as air, water and the soil pollution. And this normally happens globally due to marginalization, economic and political processes, and it disproportionately affects the different groups globally and world over. The another problem which is being addressed by the environmental health aspect is the food safety, hazardous material management, and this includes the biomedical waste and their management, land use planning, and the medical waste management and disposal. So this is normally occurring in the hospital and the healthcare sectors and the clinics, where the medical waste management and how the sharps, the needle, the injury, the bandages, the blood and all these waste have to be managed and disposed of in a scientifically proper way. Noise pollution and control and the equipments that can be used for controlling the noise, and even the green belts which can be found even around the aerodromes and other noise polluting areas. So that also can be managed properly. The occupational health and industrial hygiene, this is also a very important aspect which encompasses environmental health. Radiological health, this includes the exposure to ionizing radiations, to the radiation from the X-rays and also the radioactive isotopes which is used in chemotherapy and various cancer clinics and so on. It also focuses on the recreational water illness prevention, including that which is coming from the swimming pool, from the spas, from the water bodies, where the outdoor sports, the water sports and the yoga activities can be done. Then the safe drinking water is also being addressed over here. solid waste management. So that is also a very important aspect which is being focused, and also vector control. As I told you, when the environment is unclean and where there are unhygienic conditions operating, then again the vector rise can be seen. You can even see the monkey pox, the chicken pox, then the herpes, then various other types of the tularemia, the Q fever, many kinds of infections where there are zoonotic infections can be transmitted, and also the environment, the infections and the pollutions that are there in the environment, that itself can impact the human health and go a long way. So what are the environmental health professionals for? So they may be known as environmental health officers, public health inspectors, environmental health specialists, or environmental health practitioners. Researchers and policymakers, they also play important roles in how the environmental health is practiced in their field. Now, if we have to take an account, more than 12 million people around the world, they die every year globally because they live and work in the unhealthy environments. And you may be seeing that they are working for long hours. They may be reaching their factories and offices as early as 6 a.m. You can see here the factory sirens ringing as early as 5:30 in the morning. So that is the time when they reach their offices, and they may be working late at night. Of course, they have the shift in between. So this is all causing different types of the pollutants that are coming from the industrial operations itself and their industrial factories. So the environmental pollutants can cause serious health issues such as respiratory diseases, heart diseases, cancer, and so on, especially when they are working for long hours and long time period, that is a large number of years. Therefore, tracking the environmental pollutants is key, and it is very crucial in order to figure out where and how much and how the people are exposed to these pollutants. In the same way, we need the environmental laws and the policies in place to reduce the pollution that can help prevent and control many serious health problems. Now let us have or discuss some basic environmental pollution and with some case studies. So this environmental pollution, specifically if we have to talk about the airborne pollutants, that is causing serious problem in the developing countries, and that affects the lives of billions of people. The World Health Organization, they estimate that 25% of all the death that can be attributed to the environmental factors. Unless we opt for the cleaner fuel, the air quality is not going to improve. So that is why now we are even getting the biofuels and the CNG and other stations, even the electric bikes and the electric vehicles are coming in place. So where we can opt for the cleaner vehicles and the cleaner fuels, so that we ourselves are not contributing to the environmental pollution in any way. Now in this figure, you can see how the particulate matter can enter the body, and that can impact our health and the lungs especially. So these particulate matter and we have the PM 2.5 and PM 10 depending upon the size of the particulate matter that is entering our bodies. So this is entering our nose and the mouth, and we don't even know how small these particles are, that they are just while breathing they are entering our nasal tract and the oral cavity. So this the body can eliminate most of the larger particles when we inhale them and exhale them out, and the smaller particles like the PM 2.5 and even smaller, that can actually continue to get lodged in the lungs, and then that can cause the scarring of your lungs. So this PM 2.5 that can penetrate deep into the lungs through the bronchioles, the tracheal passages, and finally they can get lodged into your lungs, and then that can give rise to serious health consequences, and the person can have a lot of coughing, and then when it gets lodged in the hearts and the lungs, then that can cause pulmonary edema, failure, and then that can also cause a lot of chronic problems, and then we need to get ourselves treated by a medical practitioner. In the same way, exposure to mercury. So mercury is there in the air, and from the coal plants and even from the industrial operations, the mercury can be released to the environment even accidentally. We also saw even some of the CFL and the bulbs, how they were also contributing to the mercury contamination in the environments. So all this mercury disposal, even the bulbs that we are using, they have to be disposed of scientifically and properly. Otherwise, the mercury will remain in the environment, and then they can get converted to different forms, toxic forms, and then enter the water bodies, the soil, and then in that soil, if we are growing our vegetables, then we get affected in the process. In that water, if we are consuming for our drinking purposes, then we get affected in the process, because all this is a chain in the environment. The food, the air, the water we drink, so we are interdependent. We are dependent on the food, on the poultry products, for the eggs, for the cows, for our milk, for everything. So something is there in the environment, our animals, the plants, everything are affected, and then we are dependent on these for our survival, then we also get affected in the process. So exposure to mercury, this can damage the brain, the lungs, the gums, and other parts of the body. Mercury is released into the air from the burning coal and also trash, mining, smelting operations, and also from the industrial waste, and all this can get into the environment. Tracking mercury in the environment and also in the children's blood or the urine, this by the environmental health specialists and practitioners and the policy makers, that is crucial for reducing the exposure, so that we know the amount of the mercury that is there in the blood or in the urine. Now in India, in Singrauli, that is the powerhouse of the India, which has massive coal reserves and the thermal power plants. So here the Center for Science of Environment, when they did a study a few years back, they found that they have the coal component has mercury, and it has 0.09 to 0.487 ppm, and the large quantities of the burn is actually burnt in the thermal plants, and considerable amount of the mercury is then released into the atmosphere. So people are complaining of unexplained ailments, that they report that this mercury is slowly entering the people's homes, their food, and even their blood. And mercury, when it comes in the food chain, as I said, when we are dependent on the plants and the animals, then this is reaching alarming levels ranging even up to 0.058 to 0.268 mg per liter. So this is several times more than the prescribed Indian and the World Health Organization standards that are prescribed in the drinking water and also for the industrial effluents. So this mercury is found in cereals, in fish, in hair, in blood, in nails. All this can be contaminated with mercury. Now in the blood also, it has 84 ppb at a very high level, and it is 6 times more than what is actually found in the that is actually prescribed by the WHO. So mercury, if we have to talk about one heavy metal, it is poisonous, it is inorganic, and it can be converted to the organic form, which is really poisonous. And this methyl mercury, which is a conversion from the inorganic to the organic, it is a neurotoxicant. It can damage the developing brain, as it can cross the blood-brain barrier, and it can then trigger the problems related to the nervous disorders like the paralysis, then the Alzheimer's disease, Parkinson's disease, speech and vision impairment, a blinding of the eyes, then the kidney failure, and so many other health problems. And it is also carcinogenic. Even in minuscule, it can increase the cardiovascular system. It can adversely affect your cardiovascular systems, and that is reported by the United Nations Environmental Program Global Mercury Assessment Report. And it is also a possible carcinogen for humans, which is given and reported by the International Agency for Research on Cancer. In the same way, long-term exposure to arsenic, that can also cause many health problems, and so many places in the world, in USA and also in India, they have arsenic in their drinking water. And studies that can track, or these environmental health specialists who track the arsenic in the blood and in the urine, they can help the healthcare providers and the public health officials to observe if the people have been exposed to high levels of arsenic in that area, in that region, and then they can actually bring about the solutions and other health programs and awareness levels for people, so that they can even migrate to different places. For example, if it is aggravated by geological reasons, then in that case the people may have to choose different places for their living and make other arrangements. So that way the health professionals and the safety specialists, they can involve themselves with the public health officials and also the NGOs and help bring about awareness in the people living there. Now another example is in Jharkhand. Here the farmers are actually unaware of using chemicals in the agricultural sector. So there is a totally lack of knowledge among the farmers. So even the banned chemicals, they are being applied on the crops. And for example, for the crops like the cotton, the beans, the cauliflower and the paddy, they are using profenophos and also the cypermethrin chemical derivatives. The failure by the state government in order to regulate this sector has actually caused a lot of problem in this state in India. So the monocrotophos. So this is hazardous and it has been banned in India since 2005, but this is still being applied by these farmers because they don't have knowledge. They are not aware that this is a banned chemical in India, and they have been applying this on the chili, in the capsicum and the cucumber, and when then people are consuming this, we are getting affected in the process, and we are also getting pro-carcinogen activity and also carcinogenic problems in our body. Whereas in certain other states in our country like the Bundelkhand, then in Uttar Pradesh and in Madhya Pradesh, even the northeast in Meghalaya and Shillong, here the villagers are overcoming by innovating. How? They are making handmade, self-made fertilizers and the nutrients which can be applied to the plants and the crops in order to boost their productivity. So this is also, in other terms we call this as organic farming, that is living in balance with nature, or you are going along with nature. This is what I said in the very first instance, that our ancestors lived a long and healthy life because they were practicing such sustainable practices. So they were living with nature. They only applied that thing on the crops, on the plant, which they ate or which was also good for their own health. So for example, when you have ants coming in your kitchen garden, what did they do? They just took a little bit of the turmeric powder, or the natural turmeric, and they applied it over there like Lakshman Rekha or the turmeric basma. So that actually it brought about the end of all those pests or the ants that are coming in that area, because these are natural, and then they do not come there. In the same way, the extract of the neem, aqueous extract of the neem, you can just grind it in your mixie and then just put that extract on the plants in your kitchen garden, and then you will see that it can repel many of the common pests that are coming in your garden. So these are natural things that we ourselves can do in our garden. In the same way, vermicomposting, where we have the earthworms, which are actually the friends of the farmers. They can till your soil, and then they can actually, by their own metabolic activity, they are giving you the good soil, and that compost can actually be applied to your kitchen garden. For example, your own biodegradable waste, or your kitchen waste. When you are putting a little bit of this, you can create a 2x2 pit in your kitchen garden. You can put certain earthworms, and within a few days and months, you will see that the vermicompost and this manure is being formed. That can be put for your gardens. So same way in these villages, the villagers have overcome by innovation, by innovating. How? They have used the cow urine, the neem leaves, the water, the gram, and all this they have made it into a paste and a flour. In the same way, Panchagavya, from the name itself you see that this is coming from a Sanskrit word. So that is actually the 5 elements that we are getting from the cow. So the cow urine, the cow milk, the curd from the cow, all this, the cow dung, all this can be applied and used as Panchagavya, and that can be applied for the crops, and you will see that that boosts the productivity of the crops. So this way the non-governmental organizations and the public health officials, and also the people themselves who are environmentally aware and conscious, you can go about the villages, bring about the trainings, and can say about the benefits of this such organic farming, and how these benefits can be brought about to the marginal and the small farmers. Social determinants of health also, they have a major impact on the health, well-being and the quality of life. They can also contribute to wide disparities and inequalities, health disparities and inequalities. So the public health organization, they will also have to take action in order to improve the condition in the people's environments. Therefore, the impact of the environmental hazards on human health you have seen, and the humans themselves are responsible for polluting the environment, and that has shown its effect on the health. The health and the environment are definitely and directly interlinked. It has been estimated that 24% of the global burden of disease and 23% of all death, these were due to the modifiable environmental factors. So lifestyle diseases, as we say, and the environmental factors, we can modify them, we can actually create better places for living, and all this is due to pollution, occupational risk, land use practices, and also sanitation practices. Therefore, promoting social change is very important. As I told you, we ourselves can go about and bring about environmental awareness, changing the behavior of people towards more sustainable practices. This requires the changes of deeply held attitudes in individuals, in institutions, in professionals and also social organizations. And this education and awareness, this can be the biggest facilitators of social change, and that is education. Youth education, you see that youth, and when you empower the youth with education, they can actually do wonders, and they are the futures of tomorrow. So when you invest in youth and you give education in community groups, in schools, in colleges, in universities, and when you conduct summer camps, youth groups and public parks and recreation areas, all this is a wonderful means of social change. And this is an efficient way to change the behavior towards more sustainable practices. And these are some of the UN initiatives that are helping to raise the issue, and now we are seeing that there are many days that can be celebrated, though every day is important for bringing about environmental awareness and to be an environmentally conscious citizen. But still the UN initiatives are the World Water Day, the World Environment Day, World Day to Combat Desertification, which is in June 17th. Then you have the World Wetland Day, which is on 2nd February, World Environment Day on 5th of June, the Earth Day, which is on 22nd of April, the Ozone Week, which is celebrated in September. Then also we have the Habitat Week, which can also be celebrated in October. We have the World Mountain Day, which comes in December. We have the Day for the International Day for Reduction of Natural Reduction and Disasters. That comes on in October, again 2nd week of October. So the same way, and also in order for the Population Day, which is coming in July. And also paper awareness and paper recycling, we also have a day for the paper bag day, so that the consumers are using paper bags and recycle the paper. See, these are all some small initiatives that are done by the United Nations, and we can make a big change in the way we live, in the way we think and the way we act towards our environment, and that can impact our human health. So in this unit, my dear learners, we have learned the definition of environment, environmental health, who are environmental managers and practitioners, the environmental health policy makers, the different components and how the environment can impact and influence human health. And we have also studied some environmental hazards with some case studies, and the causes of environment which is relating to morbidity and mortality have also been discussed. I hope you have had a good understanding in this session, and thank you for your patient listening.